Awesome. Welcome to the Next Patient Podcast, where we explore the real challenges and opportunities facing today's leaders in physical therapy and the rehab space. I'm your host, and today I'm joined by Greg Papageorge from New York Cryogen. Greg, it's great to have you on the show. Thanks so much for being here.
Thank you so much for having me on board.
Absolutely. So to kick things off, why don't you share a bit about how you first got into the industry and what led you to grow and launch New York Cryogen?
Well, I mean, I've been around the block a little bit, so I'm not exactly a youngster. I spent over 30 years in the healthcare industry, first starting in biotechnology, pharmaceuticals, selling HIV medications and oncology products. And then I graduated. I did that for about 9 years, and then I graduated into medical devices, and specifically in complex spine and biologics, where we would offer surgical support to the staff, to the surgeons as a consultant to make sure that our implants and instrumentation are being used properly during the operating room, and also, make sure that the proper implants were being put in when the doctor would request it. I did that for many years, and kind of like make a long story short, I wound up having, 3 major back surgeries myself, and I've had chronic back pain since the age of 22. But it really came to a head when I was about 38, 39 years old. I had my first back surgery, and the surgeon told me that more than likely I'll have a second and third one in my lifetime. It could be in 5 years, it could be in 30 years from now. Well, he was right. 14 years later, it required more surgery, and I had additional areas fused in my back, which unfortunately an accident happened during the surgery and paralyzed me, paralyzed my arms, and I couldn't move my arms. And when I woke up from recovery, I had complete paralysis of the arms. So basically what they did was they tore out the nerves in my neck and shoulders, the brachial plexus. So people that have brachial plexus injuries have limited mobility in their arms. So yeah, like it's technically a palsy. It's technically a paralysis of the arms and hands, depending on the severity of it, could really be traumatic. And my case was extreme and very traumatic. But I never gave up hope. It was all about how was I going to regain the use of my arms. But as the nerves started to regenerate, I also felt the pain sensation. And there's nothing worse than nerve pain, which is very difficult to control. And I've always believed in cold therapy. And, during my rehabilitative process, the occupational therapist or physical therapist would put cold packs on my neck and arms, try to cool down the nerve pain signal. Although it helped a little bit, but it was very temporary. I was going to cryo facilities like the Restore Hyper Wellness, the franchise facilities, going into their not hyperbaric chambers, into their cryo chambers and getting local treatments from them with utilizing liquid nitrogen. And although, I did enjoy the experience, let's just say, but I got absolutely no relief from it, no pain relief at all. It was very superficial, very light. And it felt good for the moment, but as soon as the person stopped treating me, by the time I got dressed, by the time I got to my car 40 feet, 50 feet away, the effects of that wore off literally instantly. So I had a membership there where I had unlimited access to the facility, so I would use it as much as I'd like. After 8 months went by, I realized, God, I've spent so much money. Let me just buy something for the house and just do it at home. And I was very close to buying a liquid nitrogen machine for the house. And then I came across these little CO2 machines that were on the market, and the price range were from really cheap to as high as $35,000. And everybody contacted each other. So I didn't know who to believe. I didn't know anyone that had one, and the people that you could tell who the representatives were, because they were bashing the other companies. And I'm like, oh, great, here we go. It's going to be one of these situations. So I saw the potential in the CO2 devices, but they were very weak in the sense that they really didn't produce any pressure. They were really marketed for aesthetics and, aesthetic use, like cryofacials, cool sculpting, things like that. But I had no interest in that. I was interested in managing my own pain. So I got the machine and I used it, and it was okay. I said, God, if this thing just had a lot more power. I think the effects of the therapy over the modality or would be more profound. And
Right.
so I immediately opened up the machine and started reverse engineering it and changing the components to it, just basically using the existing machine that I bought as a host and converted it from British threading to American threading so I could buy parts for it and
Wow.
experiment with it. I was able to get it to produce a lot more power, but it wasn't efficient.
Hmm.
But when I started using it, the relief was good, but the issue was the skin irritation, the burning that people would
Right.
always complain about, and no one really had a real solution for it. So once I overcame those obstacles you know once I became those obstacles, and the first thing that came to mind was, well, we need to waterproof the skin because condensation would build up on the skin, and when
Mhm.
condensation build up on the skin, especially if humidity was high in the air, you would instant ice burn. The condensation and
Right.
water that up on the skin would freeze you, get instant freeze burn. So the first thing that came to mind was a product made by 3M called Tegaderm, which is used in the hospitals they have different size patches, but usually when people get an
Yeah.
IV line, the nurse puts a
Right.
little piece of film over you, and that's Tegaderm. So I put a piece of Tegaderm on someone's skin and it worked. And then the
Right.
treatments became a bit more aggressive. And then I said, let's throw some 3M IOBAN on there. And that's what's used in surgery. And it
Mhm.
worked, but
Wow.
people got the relief that they wanted, but the material was disposable. You know what I'm saying? So it was
Right.
also incredibly expensive.
Right.
So and availability of it wasn't too much of an issue, but it was just kind of like, if I could come up with a reusable material that could be reused and protects and makes the treatment comfortable, um, even better. So
Right.
once I discovered the technology, I realized that I had something. I immediately started clinical trials. I immediately started to develop a device. Coming from the industry, the medical device industry, I knew exactly what the AMA was looking for, what Medicare was looking for, what would it take to get this modality legitimized as a real pain management modality, to make it opioid sparing, a holistic approach. And I'm not saying that the drugs and the injections and all the other things, the chiropractic care and PT are bad. They're
Right.
not. I mean, I tell
Right.
people chronic pain requires chronic treatment, regardless of what works for you. So,
Absolutely.
in conjunction with my therapy, with anything else that they're doing, could only add value, to their quality of life. So I immediately started clinical trials to get this, through the AMA and get this recognized as a surgical procedure. And, and that's pretty much where we are right now. So we're been, the AMA fast tracked me right to the top. We got our billing codes right away. Then it was just a long process of getting credentialed by the Bureau of Credentialing and Joint Commissions and securing certain licensing, insurances and stuff like that. So right now we're in the process of seeking Medicare approval to get our Medicare licenses, DME, durable medical equipment. And that will legitimize me as a real medical device company, that I can produce my AC-130 Viper that I created and distributed globally. We need Medicare licensing in order to in order for us to take the next steps forward, and more importantly, to even bring it to commercial insurance like Blue Cross Blue Shield, United Healthcare, Aetna, Kaiser Permanente, depending on what part of the country you live in. We need, we're planning on integrating the technology into private insurance so people could receive the therapy utilizing healthcare insurance. And that would be a first of its kind. So, so my business model is kind of twofold. It's a device company and a service provider, where we could have affiliates underneath our umbrella, and they could be under and take advantage of my DME Medicare license, to participate in the insurance. Unless you're a healthcare provider that you already participate in healthcare insurance, then that's a different story. Then you don't need me from that perspective. They could just secure the device. We give them the billing codes, we give them the device code, and that's it. They just bill and they get reimbursed for the treatments. So
Right.
I know
That's amazing. Right.
I
That's amazing. Congratulations.
Thank you. Thank you.
And
It's
that's
been a long haul.
It's been a long haul. I'm sure it is. I'm sure there was a lot of trial and error and kind of having to go through that by yourself. It's the persistency that's allowed you to get to this point, right? And that
Yeah,
persistency has come from a need that you realized in the
exactly.
industry of course, there is chronic treatment for chronic pain, but you are trying to amplify the options, right? If someone doesn't want to go down the route of the opioids or of the consistent going to physical therapy or chiropractor, whatever it is, and going into that single session and maybe not
Mhm.
getting that long-term relief, but you actually want to explore different options.
Exactly. And I tell people that this is a pain management system. We manage your pain, but it has the potential to put you into permanent remission with whatever ailments that you're dealing with. And 6 out of the 10 patients that walk into our office are spine or back pain, lower back
Mhm.
specifically, cervical neck, a lot of sciatica pain. And sciatica is a problem. It's a problem. And, that piriformis muscle or your glute muscle that the nerve runs right in the middle of is a very thick, dense muscle. And the only way to get rid of that inflammation is with cold and with pressure and power. And that's where my techniques and the technology kind of separate themselves from the rest of the cryotherapy industry, because we have that ramming effect of the CO2. We use liquid carbon dioxide, which is dry ice. And between that and the Viper translucent material that we place on the skin, we're able to treat you aggressively with as much as 1,000 psi if need be. We have full
Wow.
control over the pressure and the spray pattern. So it's not like it's just a on-off switch. There is a little bit
Right.
of there is a methodology to the technique, and and being able to eliminate that inflammation deep into the piriformis muscle is big, because people with sciatica, it's not easy. It's not easy.
Of course. Talk to me a little bit more about that thermal imagery, because when you use the actual device, you're actually able to spot and pinpoint where the inflammation is. Is that
Mhm.
correct?
Yeah, I mean, the
Oh, is that
thermographic
something you
camera is
developed?
well, is the thermographic camera is part of the system that is essential, and
Mhm.
it serves two purposes. One, when someone comes to me and says my back hurts and they don't have any radiology reports that I like to read prior to them coming in, it's okay. The thermographic camera picks up heat patterns on the skin. It's like heat rises to the top, right? You put some fire here and the heat rises to the top. So it's a predictor of where the highest levels of inflammation are in the area that hurts you. It doesn't mean that we only treat that area. That means I have an idea of what my technique and the approach would be, and where would focus in a little bit more in those areas to really put out the fire. But more
Mhm.
importantly, it's the treatment, we take an image, but during the treatment, we stop at certain intervals that we look with the camera after, let's say, the first 60 seconds. I look at the image, and your skin is going to go from red to yellow to green to blue, or a red, yellow, green, blue, or yellow, green, yellow, blue. That's but it's not just looking at the blue. We're looking at the quality of the blue. If it's a nice, dark, deep blue in that image, that means we've gotten very deep. We've gotten very deep, and we like to get people down to about an average of about 35 degrees Fahrenheit, or that's what 1.1 degrees Celsius, I think.
Yeah. Yeah.
Um, so that's what we look for. I mean, I can get your skin temperatures down to 35 degrees in 20 seconds, but it's not deep. So by the extreme by the power, the pressure, and the relentless cold, I'm able to push that gas deep into the anatomy where the inflammation lies, and shut down those inflammation receptors, and start the healing process. Because it vasoconstricts everything, and then once I stop, all the blood rushes back in, producing more nutrients, more oxygen, and that's just a cascading effect of the therapy, of how it starts the healing process, and it works. It works.
That's amazing. And so you're talking about have you already had patients that you've been able to get to that full remission state? Or if you have they come back at some point, and what's kind of that timeline of how much relief or how long their relief would last?
Well, again, pain that's a great question. Pain is very signature to the individual. So there's no cookie cutter approach to pain management. Even like medical doctors that you go to, interventional pain, they give you the epidural shots and they tell you this is a temporary thing and you may get some lasting relief out of it. But, what I tell my clients is that I have about a 95% response rate. So people will respond. Now, what you do once you leave my office, I cannot control. I cannot control what your body does on an organic basis because you're a living, breathing organism. You know what I'm saying? We're a bunch of cells. So I can't control what your cells are going to be doing. But I do tell them that, through my clinical trials and observational trials, the average person needs 2 to 3 treatments, one treatment like every other day. Okay. And I like to space it every other day is because we treat you, your body starts to heal. The next morning you wake up and whatever symptoms that you're feeling should be less. And if you're less, the next second treatment, you'll get more profound results because we're eliminating layers of inflammation and they get colder quicker. So then we get to the root cause of the issue. As far as long lasting results, I put people into full remission with back problems, knee problems, as greater than 3 years. I've had many patients come to me treating their sciatica, giving them 4 treatments. I don't hear from them from a year. They book an appointment thinking that their sciatica flare up, and they said, "No, I'm fine. My back is fine. I'm here to work on my shoulder now." And I'm like, "Oh, okay." And then there are some people that have severe deformities in the spine. And I reference the spine because that's a lot of what we do. Um,
Mhm.
I have an 88-year-old man who needs back surgery, but he's not a candidate because of his age and comorbidities. And he comes in once every 3 weeks for treatment, and that's all he needs. So it's chronic, it's a chronic problem. He's not a candidate for surgery, but he realizes that this works for me. So I'm going to come here once every 3 to 4 weeks to keep him comfortable. And it works. It works. Everyone is different. Everyone is different.
I love that. So clarify that a little bit for me. Is there two different options? One being that they can come in on a regular basis and kind of get that treatment, non-invasive treatment, versus
Mhm.
there's a selection that they can have to actually get the deep surgery and actually really go into the deep nervous system
Yeah.
or tissue and use it?
Well, there's 2 types of patients that we see. We see the acute injuries and we see the chronic injuries. The acute injuries meaning could be like a sports related injury, a lot of ankle sprains, high ankle sprains. Lacrosse and soccer are major like recruiting hotbeds for colleges here in Long Island, especially lacrosse. So those acute injuries we could treat very rapidly. I mean, I've eliminated like a kid would come in with a rolled ankle, basketball player, and the ankle would be very swollen. And I would come in with one treatment and knock down 80% of their inflammation right away. They come in with a second treatment, and then it's like 95% better. And then after that, they either opt to do a third treatment to completely wipe out the inflammation and then get back into play through an injury is the hardest thing to do, or they're good. The people who are chronic, that require chronic treatment, we always recommend to do 2 or 3 treatments, see how you feel, and then we observe you. Okay, if you're comfortable, if you're 95% comfortable, maybe your body could organically heal that 5%, and then we observe you, and just let me know when you need more treatment, and that treatment could just be just one treatment for a tune-up if they feel it, so they know they could stay ahead of the curve by doing that one treatment. And that one treatment could be once every 3 weeks, once every 4 weeks, once every 6 months. Again, everyone is different. There's no cookie cutter approach to this.
Of course. And then talking about the acute, because me playing basketball and being very familiar with the rolled ankle myself, a lot of athletes do like to take on that mentality of just play on, right? Play through it. Obviously, you really dive into more of the chronic side of it, but do you see as your tool being super beneficial in the acute aspect because it will kind of not let those rolled ankles or those minor injuries compile into greater injuries
Right.
that later down, once we're done being athletes, we still have that injury because we never treated it in the first place.
Right. Well, I mean, the long-term data, I mean, we're still, I mean, I can't forecast 5 years from now, like long-term data, because I've
Right.
only been doing this, I mean, February would be 4 years technically. So I'm still under 4 years. But the acute injuries, for the rolled ankles, the sprains, the ACL, the MCL tears, labrum tears, up to a grade one, we can handle. We keep the athletes on the field versus being sidelined for weeks. They,
Mm.
they keep them on the field playing. I mean, obviously, we provide them with some sort of compression, sleeve if needed, support if they have something, they wear it. But we have the technology allows the athletes not to miss a beat, potentially, unless it's a severe injury. I've had many athletes that were told their season's over, and then they would come to me and their season's not over. They continue to play. I mean, granted, playing through an injury. It could be a little rough, but it's better than being sidelined. You know what I'm saying?
Absolutely.
And
Absolutely.
also get them to about 90% better or feeling better quickly, quickly. And we're not talking about weeks, we're talking about days here, you know. Does that
Absolutely.
answer your
Yeah.
question?
Yes, absolutely. And especially when you're talking about student athletes, right? Because at the end of the day, what we've discussed about before is injuries like this don't only take a toll on your body, but they take a toll on your mental health, right? And these athletes that
Yeah.
have come here, especially to go to college and say, I've worked my whole life to spend these 4 years playing and getting myself out there, to not be able to play and be sat on the sideline is truly something that impacts their mental well-being, that goes into
Yeah.
their schoolwork, and it's a whole detrimental cycle that you're helping them not have to go through.
Yeah, I mean, if you really think about what does pain do to you, I mean, it's not just dealing with the pain, but it's all the ancillary things associated with pain. It's the psychological effects, the psychiatric effects, the potential depression, frustration, sleep, the anger, amongst the other things that you may that people do. It could be, adding, like, going to physical therapy, go to chiropractic, go to acupuncture.
Mhm.
These things take time, and sometimes
Right.
not everyone wants to do that. What I'm saying, wants to do that for their own reasons. Not that they're bad. They just, everyone's looking to get healed quickly, especially in the sports world. You want to be healed quickly. Recovery is key. And we're starting to see that more, that the recovery aspect with my technology, with what I do, really does expedite the healing process, I would say by 85%. And people are just like blown away when they thought their season was over. And I'm like, no, I'm not going to let that happen. And we do a lot of post-op recovery, people who had surgeries. We virtually eliminate their inflammation in 2 or 3 treatments, and they're off the opioids, they're off the crutches, they're walking, their PT is better because their range of motion is better. They have to do less PT because of the inflammation elimination, that they could have a better quality rehab.
Mhm.
So a lot of things.
Absolutely. That's amazing. That's truly amazing. I know there can be many athletes that kind of hinder towards that. And that's just a great thing that's kind of being established and being brought new into the industry, right? Because at least I haven't heard about anyone else like yourself that's developed this type of technology, and bringing new technology into a physical therapy slash rehab space is what we kind of need at the moment, right? There
Yeah,
are and there should be ways nowadays where we can conquer pain without, and chronic pain at that, without having to either pay thousands and, have be put in a situation where you're in the top 1% in order to actually be healed and get back onto the playing field. But
right.
everyone should be able to get that treatment.
Exactly. And as as a former athlete, I mean, I got some years on you, but it's, things haven't changed. When you're in like that sophomore year of high school, junior year of high school, you're in that window where if you're a competitive athlete looking for a scholarship and you're injured, if you're not playing, you're not going to get looks. You know what I'm saying? People
Exactly.
want to see you perform and perform at your best. I've treated a lot of professional bodybuilders and amateur bodybuilders, and that overdo it, and they come in for one treatment, eliminate their aches and pains, and they go back and they could train hard and they hit new highs. And it's just the feedback. I mean, you can look at my Google reviews. The feedback has all been positive. Am I 100% successful? No. I mean, anyone that says
Of course.
anyone in the management business say they're 100% successful, I would question. But we
Right.
do help the vast majority of people. We do help. We do help.
For those watching, I have seen his Google reviews and they don't stop. I don't think I ever found the end of those. So
Thank
definitely have
you.
seen the feedback and it is incredible what you're doing.
Thank you.
So Greg,
Thank you.
let's turn inwards real quick. Taking a look at
Mhm.
your company and how you're actually scaling it. What
Okay.
obviously this comes with its own challenges, can kind of bottlenecks to you have this great idea, you have this great invention that you know will
Mhm.
help, and you have the confidence to help everyone. But like you mentioned a little bit ago, there's been times where as the person that's injured and you're trying to find where to go, you kind of end up on a marketing scheme and you see people compete. And at the end of the day, you can kind of tell that they're competing just to get you, but they're not actually interested in knowing what best treatment they're able to deliver to you. So,
Mhm.
how do you kind of reckon that you're putting your name out there in terms of, hey, I'm not like the other competitors. I'm using this different type of technology. And how are you
Mhm.
getting that in order to kind of
Mhm.
make them believe in you and get them out there to New York to actually see you?
Yeah, no, well, that's a great question. I mean, I built my business platform on social media, on Instagram specifically. I was never a social media person. Had a LinkedIn profile, but that was obviously for professional reasons. So right now, I built my entire platform and reputation off Instagram. Word of mouth, treating people, delivering results, being very transparent with people. I turn a lot of people away, by after reading their radiology reports because I can't help them. And I don't like to give false hope to people that I can't help, because if I treat you knowingly that I can't help you, that takes away from someone else that I could help in that time slot. So right now we're not actively promoting the company or we're lightly promoting the technology, because the few times that we have advertised, we were just overrun, and that gave us a little sense of the sensitivity of how powerful this is by just running an ad for like less than 12 hours. And we were not ready at the time, to handle that volume. So what we're doing is really waiting on the federal credentialing to come through, because that's going to solidify us as the only entity, the only cryotherapy company that has these credentials. So once we get the Medicare DME licensing and we get the private insurance integration, then we're going to be going after the FDA to get a 510(k) class 2 clearance, which will give it the safety recognition for the United States with the CE mark for the European market, so I could export the device legally. There's a lot of companies that are not even registered with the FDA, but we're doing all the regulatory things correctly. So in order to scale up, I mean, we have our own engineering department, we have our own manufacturing capabilities, all in-house. So there's no outsourcing of the device. The device, the AC-130 Viper, will be made here in the United States, specifically in Georgia. And we also have a secondary device coming out for the European markets. It's called the AC-135 Super Cobra. And I can't talk too much about that right now. It's a little premature, but it's already in development and it's already done. We just haven't released it yet. And that's going to be more for the Europe. That's going to be for export only. The Viper is a special tool. It's a special the medical device that's never been created before. So once we get all our licensing and credentialing, we're going to do a full marketing campaign. We already have an extensive laundry list of people interested in the Viper on a global basis. So we're not having difficulty finding people to bring this technology to their practice. So we're just kind of like, we're trailblazing here. So we're not following like a McDonald's handbook or a Burger King handbook that's been established
Right.
for 50 years, 60 years already, 70 years. I don't even know how long. It's been a long time. So we're kind of trailblazing. So it's a learning curve for us too, you know.
Absolutely. Absolutely. That's great to hear. And then obviously you're kind of stepping into this new role, obviously in the industry. So I think you are part of what my next question is going to be of how are you noticing kind of different trends going on in the industry and how are you adapting to them? Obviously, I think you are one of the leaders in the technology aspect of it, but can you also talk to me a little bit about how you're leading patient journeys, right? Because right now, patient retention is something that is super difficult, mainly in the physical therapy space, right?
Right.
How do you think that your technology or maybe something else that you're doing has actually played into helping that side of it?
Well, what we do is we make sure that every patient or client that we treat has our undivided attention. Like they're the most important person in that room, and we listen to them. We don't just treat and go. It's not a turn and burn type of thing. It's a two-way communication between the practitioner. I also have a nurse and a nurse practitioner and a PA that work at the office, and we listen to the patients and listen to them and really take a vested interest in their quality of life and see how we can help improve their life, and give them realistic expectations, and things like that. People come to us and say, I've been living with this pain for 25 years. Could you wipe it out in one treatment? No, we can't. I mean, you can't, we can't, that's not realistic, but we set the expectations that way. And when we deliver the relief, they're happy. I've had many people break down crying in the office, either in the office or at their home. We're also a mobile entity as well. And the referral network that we have now is just, unbelievable. We've been very blessed. A lot of people come to us or text me saying, like to make an appointment, I was referred by so-and-so that you've treated and helped them, and people just do find me on Instagram, and decide to. I've had people say that they followed me for 2 years before they pulled the trigger to come in for treatment. They said they should have pulled the trigger 2 years ago. I said, well, better
Yeah,
late than never. Better late than never.
exactly.
We're strictly a pain management company. We're not going to be going into the aesthetic world, and there's nothing wrong with the aesthetics. It's just that my passion is in pain, chronic and acute pain and post-op recovery, pre-op prep, for surgery. That's really where my passion is, in pain, and living with chronic pain myself. I get it. I totally get it. So that's where we're going to be. And that's really where going to be our focus is on, and developing other modalities, not modalities, other devices that will help in recovery, as well as, clinical effects, actually medically, clinically, helping people. I mean, we're talking to a lot of major universities throughout the country, looking to collaborate to do clinical trials. That's another thing that we're going to be doing is once we launch the Viper, I'm going to start a clinical trials division looking at other autoimmune diseases that are inflammatory based. And there's so many of them out there, from rheumatoid arthritis, psoriatic arthritis, lupus patients have a lot of inflammation. They wake up one day and they go to bed, their knee is normal, and then they wake up the next morning and their knee looks like a water balloon. Like they got, that's just unfortunate. But we're looking at things like that, irritable bowel syndrome, digestive disorders that are inflammatory based. So it's not just about providing the service, but we're also going to do more research. Do more research and kind of expand our indication. I mean, pain management is a very broad umbrella, but we want to look at spinal stenosis. I want to look at spinal disorders and things like that. Listen, if we could avoid somebody getting a surgery, it's a win-win for everybody. I'm saying, it's a win-win for everybody.
Absolutely. Absolutely. Well, that's some great insight. Specifically, I didn't know that you did mobile visits. So is that just centered in New York, or is your next
No.
milestone going to be trying to get outside of New York as well?
Well, initially, when I started the business, I started as mobile, exclusively mobile, right before COVID. And then when COVID happened, that changed a lot of things. People didn't want in people's homes. So where I'm located now at the gym, I've been a member there since he practically opened. And I asked the owner, hey, listen, I mean, would you mind if I just go in the back and treat people in the open by the batting cages and treat people in the open, or I put a partition up for privacy? And he goes, yeah, go ahead, because it's COVID and lockdowns and you couldn't be on the streets. And that's how it all started. And then as the business grew and my reputation started to grow and people were coming to me, it started to become very busy. And then my female clientele was more than my male clientele. And I said, all right, I need to build an office here. And I spoke to the owner of the gym, and they built me an office inside the gym, to give the privacy, not only for the men, but especially for the female population, to make them comfortable. But the mobile right now, we're still mobile. I have a nurse that she's strictly mobile in the Nassau and Suffolk County, Long Island. If someone in the city limits needs mobile services, I'm available. But I would say right now, 90% of the people come to the office for treatment, and they come from all over, from out of the country, out of state. So been very blessed to meet a lot of people from a lot of different parts of the world.
That's amazing. Well, it sounds like on the entrepreneurship side, I think most business kind of gets to this point, but you have seemed to overcome it. So I would love to hear your advice on once you get to that point where you're getting too many people at one time and you're like, hey, maybe I can't actually scale or I can't actually attend to all of these clients that I'm having right now. Did you ever get to a point where you started pushing people away and said, hey, let me stop and set up something first, or did you just figure it out as you went?
No, I kind of just figured out as I went. I mean, we operate 7 days a week. Pain never takes the weekends off. That's my motto. So, we're open Monday through Friday from 9 to 7:30 p.m. and on the weekends from 9 to 3 p.m. And if they need after hours, past those hours, we accommodate. Um, so we are scaling up with our staff has been, what's really the best way to describe it is like softly scaling up. I have a nurse and a nurse practitioner and a PA that's going to be working in the clinic. And as we get this credentialed and licensed and we start accepting insurances, then we are going to be only having licensed medical practitioners administering the treatment, to people. So that's how we're going to be, accommodating the volume. I'm expecting a lot of volume with the insurance acceptance, because a lot of people on Instagram have asked me, do you accept insurance? And when will you be accepting this insurance? And I said, yes, yes, yes. It's a process. Unfortunately, right now the government is is shut down right now, and Medicare is only at 30% capacity. That's what they say. It's probably 20% capacity. So it's kind of slowed me down a little bit in that respect. So that's been a little bit of a challenge, kind of overcoming the red tape, the bureaucracy. Nothing bad, just it is what it is. It is what it
Of
is.
course. Of course, it is what it is. And I know you always mentioned that, other companies typically have a really strong problem, or it takes a lot longer for them to get all of these certifications and clearances. And you were able to kind of get those right away. But I mean, other than this last part of the Medicaid and getting those to go through, hopefully after the government opens up again, that will be coming in shortly. But why do you think that is? Why do you think you had such a short time frame?
Because I was the only one that, did actual clinical trials to legitimize it, to study this with, you know, looking at people who suffered with pain. My clinical trials abstract and full study is on my website. I legitimized it. I put it in a controlled setting where we're able to monitor patients' pain levels, and I used thermography in the study and there was a clear correlation between baseline treatments before each treatment and the lower baselines of skin temperatures in the areas that we were treating. So it was and their pain scores going down. So it was very clear to the AMA that this works, that this legitimizes it and really works. Obviously, further studies are needed. So we're looking to expand that knowledge base, with partnering up with physicians and hospitals to do more trials.
Awesome. Absolutely. Um, all right. We're running down to two last questions that I have for you.
Okay.
One being, and there's no right or wrong answer.
Okay.
Um, Now in the physical therapy space, in the rehab clinic space, do you
Mhm.
see that there is room to have a successful physical therapy space for the business and for the patients without new innovative technology?
Well, yeah, I mean, this technology fits beautifully into physical therapy practice. What do they do? You know, they rehab you. You know what I'm saying? They rehab you, and they make you stronger. You know, I mean, I've had my fair of surgeries, and I've been through plenty of PT, specifically with my back, and you need them. You know, you need physical therapy to rehab your back from a major surgery, knee, shoulder, back, whatever. But the technology fits beautifully into physical therapy because it aids in their recovery. It aids in their healing. It speeds up the healing. It reduces their pain. And it just the people's sense of well-being increase, which makes them happier. They sleep better. We know sleep is critical, just for everything, not just from recovering from a surgery, but just maybe running a marathon or just exercising. People need to sleep, and people that are in pain, chronic pain, that their pain is not managed, don't sleep, and then it's just a cascading effect where then depression and this and that. So in the physical therapy world, that's going to be one of the biggest markets that we're going to be targeting and introducing this to them. And the people that we've shown it, they're all like, can't wait to have it. And they're just waiting. They're waiting. And I'm like, well, I'm waiting too. So,
Yeah,
so it's going to be a very, it's going to be fantastic, in the PT world, as well as the chiropractic world, and, pain management and recovery facilities, nursing homes, the elderly. I mean, it literally, there's not a single person that walks the face of this earth that this technology cannot help. Everyone has something, a certain level of pain or chronic or acute injury, so it affects a lot of people, a lot of people.
absolutely. And I'm excited that you are the innovator that's going to capture, all those physical therapy spaces and be able to reach out and finally give people that well-deserved, pain-free
Yeah.
type of lifestyle.
Yeah. I mean, we're just waiting, it's just a waiting game right now for me. I guess I got handcuffs and shackles right now, but
Yeah.
once the handcuffs come off, then I'll be able to really make my next move. But the next hurdle is getting that DME license, which is monumental. It's a gigantic hurdle because then I would have met all the strict compliance laws, then regulatory laws for DME and as a medical device company. And that's what kind of separates us from the rest. Not that the other companies are in a bad place. I'm not saying that we're better. We're just different. We're just different. People always ask me, well, how does it compare to this machine? Well, I said, listen, stop right there. I'm not going to compare. I said, we're different. And the difference is really the full control over the spray aperture, the spray pattern, and the power and the volume, and the translucent skin protective material that we use. So we're different. The other companies don't have that, but that's why I don't like to compare.
Absolutely. Absolutely. Well, Greg, how about if you had to give advice to founders in physical therapy and rehab space, whether that be from the innovative side of it or how you're actually treating patients or collaborating
Mhm.
with your patients to get them to their success, what advice would you give them?
Well, I would tell the physical therapist, I mean, obviously they're all excellent people, to not to give up, not to give up. I mean, everyone is a challenging patient. Everyone is different. There's no cookie cutter approach. I'm sure all of them would agree that, everyone is unique in their own way. It could be either in their morphologic makeup or their personality, their characters. That's, as a human being, we're all uniquely different. And the technology that I offer them could empower them to make them feel better. So from a business perspective, they would have to I would just be consistent and never give up. Never give up. There's always a solution to a problem. You just have to find it. Sometimes it happens in 5 seconds. Sometimes it happens in 5 years. So, when I discovered the issue with the skin protection, based upon my work background and my experience in the operating room, that material 3M is completely useless to anyone outside of the operating room, but I knew about it because of my background. So constantly pushing the boundaries, and never give up. Always look for something that's going to improve your patient's quality of life. Now, from a patient perspective, I'm almost like a counselor to some of these people that come in when they say, I'm in so much pain, you have no idea you have no idea how much pain I'm in. I'm like, well, would you like to trade shoes? You wouldn't last 5 minutes in my shoes with what I go through. So, so when I talk to people, I talk to them and counsel them to say, listen, don't give up. Okay. You have to find something that works for you, whether it's high pressure cryotherapy, whether it's PT, whether it's occupational therapy, acupuncture, deep tissue massage, soft tissue massage, whatever works for you, find it, lymphatic drainage, whatever works for you, stick with it. Okay. Stick with it and don't give up. Always kind of be, is the glass half empty or half full? And I always tell people, you cannot pray for a better past, only a better future. So what's done is done. If you had an injury and it happened 5 years ago, you can't change it. So kind of look at your present moment. What could you control, and you can control your destiny by self-fulfilling prophecy. So if you're saying that I'm going to get better and I'm going to do all these steps to get better, you take a guess what's going to happen. You will get better. It's just a matter of time. And there's always a solution. There's always a solution to a problem. You just have to figure it out. I found that out through, all the problems that I had to overcome with my technology. I overcame, and right now it's perfect. It's perfect. And I'm still always looking to improve it. But, I always looking to improve it. But right now I'm pretty content with where I'm at right now with the whole system. So never give up.
I love that. Match the mindset to the future. I like that. And for you, if you could fix just one thing today, whether that be making more money, saving more time, cutting costs, which one would you say is your top priority?
Honestly, I would trade everything to have my pain eliminated. It's interesting enough that I initially, bought a machine to treat myself, and that my own technology doesn't even work on me. Saying so, it's kind of ironic that I discovered something with the intentions to treat myself, and my pain is neurologic pain. So it's not soft tissue inflammation pain. It's neurologic pain. But I've developed technology that I'm helping thousands of people around the world, tens of thousands of people around the world. So far, I wouldn't change. I wouldn't change a thing. I've done, listen, we make mistakes along the way, but you learn from your mistakes and you grow. And if you repeat the same mistake, it's shame on you. 3 strikes and you're out, as they say in baseball. So far, so good.
And what would you say is one of those biggest lessons that you've learned?
That's a tough question. There's been a lot of lessons, just like, I guess, always have your guard up. You have to put a certain amount of faith in people, because when you're bringing on people to work with you as a consultant or as an employee, you have to put your faith in them. But you also have to keep your guard up, because, not everyone has good intentions. Not everybody, wants to do the right thing by you. Not everyone shares your vision and passion, so, you have to make sure that you align yourself up with people that see your vision, they see your mission statement, and kind of like, and roll with it. I'm saying? It's not about the money. It's, people will argue, well, you're doing this, to make, billions of dollars. Like, no, I mean, you need money to keep the machine going. I'm saying? In order for the process to start. But really, the biggest satisfying thing that I get is just giving people pain relief. And they're saying that I feel so much better. I get text messages every day. I said, I can't believe it. I'm pain free. It's unbelievable. So I wouldn't change a thing. From a business model perspective, I wouldn't change a thing.
Well, Greg, you've shared so many valuable insights with us today. I thank you so much for being on NextPatient Podcast. And thank you for all that you've been doing in the industry. continue to innovate. I hope that you can continue to innovate to that point where you find your next solution. Because, like you just said, never give up. So, if your pain's still not gone, Greg, we're believing in you and we're hoping for you to
Thank
figure it
you.
out.
Thank you so much. I mean, I have some tricks under my sleeve, let's just say. So I love the shock and awe factor of what I do. That's why some of the some of the music that I play, I've toned it down with some of the music that I play. It's an aggressive treatment, but it's safe and comfortable. So we have some things in the pipeline and development that's really going to revolutionize things and change a lot of things. You know, Hopefully my visions of those devices or those machines will be to what I like them to be. And hopefully we could bring them to the market sooner than later. So, but it's a lot. It's a lot, especially the avenue that I'm going with regulatory and insurance. It's a very difficult process, but that's one thing that I would never change because I want it to be different. In order for you to be successful in anything you do, you need to be a little different than the rest. And you just can't be like another Me Too company. Because if I wanted to be another Me Too company, I would have had this project done 2.5 years ago. But I took the harder route. But that's just me. That's just me. I like a challenge.
Yep. And hopefully that will always come with more reward.
Yes, hopefully, Marianne. Appreciate the time.
Absolutely. Well, thank you so much for your time, Greg. If you guys would like to learn more, please head over to their website or connect with Greg on his LinkedIn. But you can head over to NY Cryogen or AC-130 Viper to check out his new technology. Thank you again,
Awesome.
and we'll see you in the next episode of Next Patient.